Hello students, today we shall start with Medical Surgical Nursing 2, and in that we are going to start off with the cardiovascular system. A simple topic for today that we are going to be learning is atherosclerosis. Now what is atherosclerosis? Atherosclerosis, it is a disease of the arteries, and what happens there, it has deposition or deposits of fatty substances in the inner walls of the arteries. So meaning it is basically the disease of the arteries wherein there is fat deposition on the inner walls of the arteries. Now the terms generally that is used that you will generally hear are arteriosclerosis or atherosclerosis. Now they can be used interchanging at times. Now when we say arteriosclerosis, again it means the same thing. It is nothing but it is specifically telling you arterios. So it is basically the disease within the on the inner walls of the arteries, or a disease of the arteries wherein what happens is the arteries becomes thick and stiff. So what happens is this actually does not carry the oxygenated blood to the different portions of the body. So basically you will hear that arteriosclerosis and atherosclerosis are the terms that are used interchangeably, and this basically refers to the buildup of fats, cholesterol or any other substance on the inner walls, and that particular deposition is called as the plaque, P-L-A-Q-U-E. Now what happens, the plaque can cause the arteries to narrow down, which means the inner lumen of the arteries becomes very narrow, and then what happens, the amount of blood that is flowing through that particular vessel is reduced, and eventually what is going to happen, the oxygenated blood that is being supplied by the heart to the rest of the body gets diminished because of this disease within the walls of the arteries. So that is what we are studying today. So basically atherosclerosis, also known as arteriosclerosis, or you can use it interchangeably, again both refers to disease of the arteries wherein there is fat deposition, and this particular deposition of all this fatty substance, cholesterol and lipids, all this is known as the plaque. Now this picture here is actually showing you the clear difference between a normal artery and an atherosclerotic artery. So you can really appreciate how the lumen is. The normal artery has a bigger lumen and it is very distinctive with all the layers of the or the lining of the arteries or the layers of the arterial wall, whereas here you see that the lumen is reduced, or it is diminished, or it's minimized, and you see this portion here, you will see that there is the fat deposition. And what happens here, even there is the damage of the endothelial lining. So this particular deposition of lipids, calcium or fat within the walls of the arteries is called as the plaque, and this plaque, what it does is it reduces the lumen of the arterial walls and eventually blood reduces. Now here again I've just giving you the explanation of what is arteriosclerosis, wherein in the form of a definition you can write it as, it is the hardening and narrowing of the arteries. It can put blood flow at risk as the arteries become blocked, and this diminished results of the blood flow is due to the fat deposition, and eventually what happens, there is even the endothelial lining is damaged, and what happens, the arteries are not able to sufficiently carry blood to the different parts of the body. Now this can occur in any part of the body, right from your head to your toe. So it can be in any portion, and now anything that is affecting your heart, that is called as the cardiovascular system, or so any disease related to the arteries associated with your cardiac system, again it is called as the cardiovascular disease. Also in short it is called as CVD. And this is the cause of heart attacks, strokes and any other peripheral vascular disease. So together with all this, when you say the person has got arteriosclerosis or atherosclerosis, and if it is related to your particular cardiac system, or anyway even your vascular system, again it means all the other arteries in the rest of the body, your upper extremity, your lower extremity, again it can be your the arteries that supply blood to your brain as well. So anything that is associated with that, or any disease that comes up as such, is called as the cardiovascular disease or CVD. And what happens here is, due to this particular narrowing, when any portion of your artery, either it is supplying blood to your brains, or it is supplying blood to your upper extremities, it is supplying blood to your lower extremities. Anywhere the blockage can occur, and what happens there is again the same thing. There will be plaque build up or nothing but the fat deposition, eventually minimizing the blood flow to that particular portion of the body. Again, here's a picture again showing you very clearly about how the disease progresses. So this first artery picture is very normal. So you can see a very well clear defined lumen. You have your blood flow that is happening adequately. Whereas here you can see that the inner lining of the artery, again there is slight plaque deposition. It is just begun. Okay, and then what happens is the lumen is slightly narrowed when you compare to the normal artery. And here, as you see, as the disease progresses, you can see that how the lumen gets minimized. So there is thorough deposition of fat, lipids, cholesterol, and that is how, and this eventually can become really hard, and it can also becomes like calcified, means it can become a very tough plaque and really hard like or rock like. And eventually what happens, there is no way that the body is going to receive this adequate blood supply, because this is what is blocking the lumen. Now again here a very clear picture which is showing you thoroughly, when you see the cross section of it, how your normal arteries it looks like, and or how it is supposed to be, and the amount of blood that is supposed to be flowing through it. But whereas here you can see that all the yellow things that you see on this inner lining of the artery are nothing but the plaque or the fat deposits, and that is nothing but also called as the atherosclerotic plaque. Now let's see what are the causes of this particular disease. Now this cause can be due to various factors. Again, it is definitely age plays a very important role. The gender also plays, because yes, it can affect both men and women, and eventually we can see when we're learning about cardiovascular disease, the epidemiology about how it affects men and how it affects women. But here in atherosclerosis, some of the main reasons or the causes for this particular disease includes high cholesterol, high blood pressure, inflammation, anything like any kind of inflammation and infection that has happened, and eventually how it affects the heart, the inner lining of the heart, and how it eventually progresses as a real disease of the heart. Also, when you say inflammation, it can be related to from your arthritis or anything related to your systemic lupus disease. Also, obesity and diabetes can also be an important factor. Also, smoking. So these are all the important causes that can lead to this particular disease. Now next is the clinical manifestations, means the signs and symptoms. Now how does a person know that he has this particular disease? So basically when we say that this is like a cardiovascular disease, or when you say that it's a cardiovascular disorder, CAD, or you can also call it as coronary artery disease. When it is very specific to the heart arteries, then we say call it as CAD, which is coronary artery disease. Okay. Now, why does this occur? That we know what is the etiological factors. Now, when that occurs, how does the patient feel? So he may feel that he may have unusual fast heartbeat, also called as arrhythmias. There can be pain or pressure in the upper portion of the body, and that pain again, it can be radiating. It can start off as a slight pressure on your chest. It can be a crushing pain. It can be a very stabbing pain, like means very sharp pain. Sometimes what happens is the pain can start radiating. So from the chest, it can go to your arms. It can also go to your upper neck and also to the jaws. Okay, and some people can also start to feel the pain at the back of as well. Now, anything like this that happens in your chest area, when the patient starts to feel that crushing pain or the throbbing pain, and he's not able to breathe properly, then it is indicative that yes, this person is having a chest pain, and that particular pain is called as angina. Okay, so the other clinical manifestation can also be shortness of breath, nothing but also called as dyspnea, or it's in simple words, it's nothing but the patient is going to be having difficulty in breathing. So these are the clinical manifestations you would see when a person is experiencing this particular. Now, some of the symptoms that is related, now when I've told you that this can affect any part of the body, so be it your brain, your upper extremities, your lower extremities. So when it is associated to your brain, so what really happens there is the heart, even though it pumps out blood, that sufficient blood is not able to reach your brain, because the arteries that is supplying blood to the brain is blocked due to this particular plaque or the fat deposition within the brain arteries. So what happens there, in case the person has got this particular disease that is affecting his brain, the arteries that is supplying to the brain, he's going to be experiencing symptoms like numbness or weakness in the arms or legs. Sometimes you can also start to see that the patient finds it difficult to speak, okay, maybe there is slurring of speech, and what happens, there is drooping of the facial muscles. You can start, like just how you seen a patient with paralysis, how you can start to see that one portion of the body starts to lose its elasticity and it starts to sag. So that is what it is. The patient will eventually have a paralysis. Sometimes it can start off as a throbbing pain, like a pain in the head, which is nothing but a severe headache. So that can also be some of the clinical manifestations. Eventually, it can also affect people in different ways. So sometimes the person is also going to be having trouble seeing, or nothing but his vision is also going to be affected. So these are the some of the symptoms when this particular disease is affecting your brain. Now, when these arteries that is supplying blood to your legs, your upper arm, your upper extremities, and also the pelvic area, if that is affected, then what happens? The person is going to be experiencing severe leg pain, and especially it gets worsened when the person is walking. He cannot walk for long distances. He's going to start feeling the pain and he will have to sit down and rest. So this pain can become very, very excruciating, nothing but very, very severe as the disease progresses. Eventually, since you know that this particular indication is nothing but what the arteries are not able to supply the adequate amount of blood. So when there is no adequate amount of circulation reaching that portion of the body, definitely the person is going to be feeling numbness. Okay. Now, the same thing if it is going to be affecting your kidneys, then what happens? There's going to be high blood pressure, and eventually as the disease progresses, the person is going to be experiencing the condition called as kidney. What are the risk factors that is associated with this particular disease? Means what are the main which actually aggravates or which actually complicates this particular disease? So some of the more, as I told you, these days it's very, very common, and this is mainly because of our lifestyle. So the amount of junk food we eat, the amount of food that we eat from here, there, and everywhere. The other habits like smoking, alcohol, and if you're not a person who's exercising regularly, there is no physical activity, you're not eating right, which means you're not having a balanced diet, you're not having good enough fruits and vegetables. So diet and exercise, your lifestyle, your habits, everything plays an important role. So as you go with all this unnoticed, then what happens, eventually this disease can progress and becomes very, very drastic or complicated. So some of the risk factors includes abdominal obesity, or even rather obesity itself is a great complication for the cardiovascular disease. Diabetes is another complication. Alcohol intake, smoking, high blood pressure, high cholesterol, not eating a balanced diet, not eating adequate amount of fruits and vegetables in your daily diet, not exercising properly or not exercising regularly, and if you're a chronic smoker, also if there is a lot of stress associated in your lives, that also is an important factor, or rather the risk factor, and that is going to make the disease worse and put the patient into a complicated situation. Now, as I mentioned earlier, the cardiovascular disease, now that can or atherosclerosis, it can affect any portion of your body. So basically, having this disease, the person can end up having a coronary artery disease, or a cerebrovascular disease, means it's affecting the brain, and the peripheral artery disease means it is affecting your extremity. So either be your upper extremity or your lower extremities. Now, coronary artery disease means it is the disease of the heart arteries. So basically, the artery supplying blood to your heart, and that is when you would have heard about the term the person had chest pain and he had a blockage in the artery. Yeah. So that means that particular that particular condition means that yes, this person is having this atherosclerosis in the heart arteries or the coronary arteries. So then that condition is called as the CAD, or coronary artery disease. And CVD, or cerebrovascular disease, means that particular arteries that is supplying blood to the brain is being affected, and that is what we saw as the clinical manifestations, where the person is having trouble with vision, he's not able to think properly, paralysis, facial drooping, slurred speech, and also numbness and severe headache. So everything, the brain functions, or the main roles of the brain. So when it is affecting when the circulation is being affected, that is the arteries that is supplying the blood to the brain are not doing their job properly, then these would be the signs and symptoms. And PAD or PVD, also nothing but peripheral artery disease or peripheral vascular disease. Either way it is called as, like how we called atherosclerosis arteriosclerosis. In the same way, the arteries that are supplying blood to the extremities, if they are affected, then it is called as PAD, that is peripheral arterial disease, or also known as peripheral vascular disease. And you have also discussed the signs and symptoms that the patient will be experiencing excruciating, and there will be severe difficulty in walking, and especially when the person is a diabetic, it makes it worse, and when there is a wound, it does not heal, and eventually the best solution for this, if it ends up having the patient having the complications of this particular disease, death, eventually the ultimate complications or the last resort that the patient has is chest pain. Aneurysm is nothing but removing that portion of the bulging, or that the disease does not spread, but when the arterial walls become weak, controlled. So as the blood flows, there is the blood pressure. So because of that, the arterial wall bulges and it becomes like a pouch, like a sac, like which you will be studying in the eventually. So any bulging of the heart of the arterial wall and due to some kind of weakness is called as aneurysm. Chronic kidney disease, coronary or carotid heart disease, heart attack, heart failure, peripheral artery disease, stroke, unusual heart rhythms, nothing but arrhythmia. So these are the complicated conditions. Now, when a person has this disease condition, how do we diagnose it? It's very, very important that you diagnose and you screen the patient at the right time, and then you can offer the timely management. So most of the complications can be minimized. So how do we do this? It always starts with a thorough physical examination, history collection. Okay, so that is a basic for any disease. So when the patient walks in, you're going to be talking to the patient, trying to collect as much as information as possible, the data, trying to understand his signs and symptoms, and trying to understand some of the etiological factors, but trying to understand his lifestyle, trying to understand what kind of a job he does. So you can put all this together when you're collecting history from the patient, and eventually come to a conclusion with the diagnosis saying that yes, this person is having arteriosclerosis or atherosclerosis after listening to the patient's history. Now, not just this will be sufficient to diagnose a particular disease, but apart from this, the other tests will also include an angiogram, where what happens is the patient will be directed to a cardiologist, and again the arteries will be looked at under x-rays. So that really shows us whether the arteries are normal in shape, or whether there is a blockage, is there sufficient blood flowing through the artery, and every little detail can be studied by doing an angiogram. Again, doing a comparison blood pressure test, blood pressure monitoring either in your lower leg and arm. So that is how you compare the blood pressure changes or the difference, and that actually indicates yes, the person may be having some kind of an arterial disease. Some of the blood tests will also look at for this particular condition, like you will be checking out the complete blood profile, and that includes the lipid profile, which is something but you're looking at the cholesterol levels, and very, very important is also your blood sugar tests. Okay, a chest x-ray to check the signs of heart failure, CT scans, and also magnetic resonance angiography, MRA. Okay, so again, just like how we say MRI, here what we do is magnetic resonance angiography is done. That is nothing but injecting a contrast or a dye, and that is going to check or assess your arteries condition, and that is going to tell us whether the arteries have been narrowed in some places, and if there is hardening of the arteries. Definitely the person will be getting an ECG done, which is nothing but assessing your heart's electrical activity, which is very, very important. Also, some of the other diagnostic tests will include stress test, in which you exercise. Okay, and what happens, you're putting your heart at a very fast pace, and then you will start to assess how much your heart is able to function. So in that, you're going to be watching your heart rate, your blood pressure, and how about your breathing as well, because you know that in this particular condition, when there is no proper blood supply, or when there is increased demand of that blood supply by a particular organ, then what happens definitely, and when the body is not able to deliver that, yes, the person is going to be experiencing pain, and there is definitely going to be shortness of breath. So this particular test is going to be assessing that, and eventually what happens, the doctors can conclude by looking at your ECG, your investigation report, that is nothing but your pathological reports, you are having your MRA or a CT report, along with the other, your ECG and your stress test report. All this together, we can conclude that yes, the person is having an atherosclerosis or cerebrovascular disease. Now, how do we manage this particular condition? Now, this is pretty simple, because when you know this at the start, or especially when you're basically looking at these your lifestyle, because these days we all are very conscious about our living, our lifestyle, and we all are into doing a lot of physical activity in different ways, playing sports, going to the gym, going for walks, doing yoga, meditation. So all this is basically you're trying to help yourself or your body cope up with the stress, or nothing but trying to vent out your stress in some way. You're hitting the gym, you're working hard, means you're trying to remove that extra stress or the strain that is within you, by doing this enormous amount of physical activity. So some way or the other, you're making your body work and you're able to sweat it out. And then what happens, the organs are also better functioning. Eventually all this is also going to get dissolved. But sometimes what happens, if it's a genetically there, like when the entire family has got this histories of cardiovascular disease, and then you don't have a choice, and especially when there's somebody in your parents, again in the family, have got diabetes, high blood pressure, then it tends to get passed on to the children as well. And then in such conditions, we need to look after ourselves. You need to improve your lifestyle, and lifestyle changes nothing but includes increased or enormous amount of physical activity. You do it on a regular basis. You have a healthy diet, and also you quit all the other habits such as smoking, alcohol drinking, and all that. So, and also important is how you cope your stress. So all this, when you manage, your lifestyle is being taken care of. Apart from that, when you do that, when you still feel that doing all this, and especially, yes, one more thing I forgot is your obesity, which also plays a very important role. Nothing but your body weight also has to be controlled. So you need to look into all this. Now, even after doing all this and you still feel that no, I'm not getting anywhere, and I still do the blood test and I still see my cholesterol levels are high, then what do we do? Then maybe when you go to the cardiologist is not going to give you medications in one go. When you go to the first sitting, he will suggest to you with your lifestyle changes, means your physical activity, your diet, your exercise, and quitting all the other habits like smoking, alcohol, and also trying to cope up with your stress. So this is going to be told to you, and you watch yourself for the 6 months, or maybe 6 to 8 months, and then what happens, you do a blood test, or how you feel, you watch your weight, how you feel physically. You're going to be feeling well, you've got a lot of energy to do things, you're able to do your activities, and you feel that wellness or the goodness in you. But in spite of doing all this, you still do not feel that positivity, or you don't feel that effect. Then what happens, you go back to a follow-up visit, and then maybe you get yourself checked again, or there's a blood investigation done. Again, your cholesterol levels are being shown high. Then what happens, maybe the doctor will suggest you to do a lipid profile, again check your cholesterol levels, and depending on how high the levels are, maybe you will be put on some medications to control your lipids, your cholesterol levels, and along with it you will be having medications to control your high blood pressure and also high sugar levels. Okay, so all this along with your lifestyle changes. So you do everything, your activities part still continues, you're trying to be regular with your exercises, you're having a well balanced diet, you're eating right, you're making sure that your stress is under control, you're not engaging in any sort of habits such as excessive smoking and drinking, and you're also making sure that you're on these medications, which is going to keep it under control. So when all this is done in a way, then the disease condition can be under control. Now, in spite of all this, again, it's just lost control. It has gone way beyond. Then how do we do? Now, in the diagnostic measures, I discussed with you, saying that this can be assessed by doing an angiogram. Now, angiogram is nothing but you're taking pictures of the heart arteries, or as I told you, angiogram again does not mean only the heart. If you think that the pain is in the chest area, yes, you know that it is associated with your heart. But if you know that the pain is in your extremities or your arms, then you know that there is some problem with the circulation in your extremities. So an angiogram of your peripheral vessels, or your carotid vessels, which is something but you're supplying the brain, or if it's an angiogram of the heart, then definitely it is going to be showing how the vessels are, how narrowed the vessels are, or are there any blockages, means there is total cut off of the blood supply. Then what happens, you will go and get this fixed. So you will be having an angioplasty done, which is nothing but the doctors or the cardiologist will put a stent in. A stent is nothing but a little device made of chromium or titanium. There is many in the market these days. So you put that little spring-like device within your artery, and what happens, that particular little device will keep your arteries open, and and through that the blood supply is going to be restored. And what happens, the organ or the muscle is going to get the adequate amount of supply, and the patient's problems can be resolved. So angiogram followed by angioplasty and stenting can be one of the solutions to this particular problem. Now, if the person has got more than 3 blockages, and if the arteries are very, very bad, if it is terribly blocked, then the only solution is having a bypass surgery done. The other procedure also includes endarterectomy. Endarterectomy is nothing but removal of the plaque. As I told you, this fat deposition within the inner walls of the arteries can become extremely thick and calcified, and it can be really stone-like or really hard. So what happens at that time, even putting a stent in is impossible, because the thickness or the deposition of that plaque has taken ages, and it has come to a state where it has become very, very rock-like. So that means it is very hard, and if a stent cannot sit in. So at that time, what happens, you go in for a surgical procedure where it is really removed, like it is literally removed from the heart, from the arterial wall. Fibrinolytic therapy again is nothing but a drug. What happens, it dissolves the blood clot. Sometimes what happens, even the blood clot sitting there can also block the artery. This can also cause the blockage of the circulation. So a fibrinolytic therapy is nothing but a drug that dissolves the blood clot, if any, in the artery. So these procedures are the ways that a person can be managed with this particular disease condition. And that's all for today, and with this we finish the topic atherosclerosis. Thank you.